Welcome to the Gutsy Fertility Podcast, where health empowerment meets heartfelt conversations. I'm your host, Dr. Mandy Patterson, functional naturopath and fertility expert. Each episode of the Gutsy Fertility Podcast is a journey through the most pressing health topics of our times, viewed through the lens of functional naturopathy and emotional empowerment. So get ready to get gutsy with me as we hop into today's podcast topic. Hello, everyone. Welcome to the Gutsy Fertility Podcast. I am so excited about our guest today. I think we are kindred spirits and souls, and having worked in conventional medicine around many different things, and just also being conventionally trained, but then also alternatively trained. So Dr. Spencer Zimmerman is a clinician and founder at Idaho Brain and Body Institute, where he helps individuals struggling with neurological, psychological, and body-based symptoms and conditions. He's refined his unique method over the past 9 years and has worked with over 3,000 patients. He's the author of the best-selling book, Brain Reset: 7 Steps to a Healthier Brain. He's uniquely cross-trained as both a chiropractor and a nurse practitioner. He's a diplomat in chiropractic neurology, a peptide certified provider through A4M, and has extensive training in functional medicine and functional immunology. Our brain defines who we are and what we become in life, but unfortunately, it is one of the least evaluated parts of our health, despite playing a role in everything. Welcome to the show, Dr. Spencer.
Hi, thanks for having me. I'm excited to be here.
Yeah. So let's talk about, how many people out there are a chiropractor and a nurse practitioner? I don't know anybody. So you're the first unique practitioner and colleague that I met in this space that is trained in this manner, which is really cool, right? So let's kind of talk about how you got into what you do today, and how that really just inspires you to help all of these people you're helping in Idaho and all over the place.
Yeah, so when I was in chiropractic school, they always were like the nervous system's master system of the body. And believe it or not, it was actually kind of cultish because no one wanted to really understand it. And I was like, okay, I think I'm going to leave. But then I found a group that did functional neurology. And I was like, oh, hold up. So I dove headfirst right into their program instead of dropping out of school. And
Yeah.
during that, in chiropractic school, right, you get adjusted all the time from other people. And my wife, right, she'd go in, she'd have some headaches and neck pain that she'd had since we've known each other. But one of the things that happened was chiropractic, depending on the ones you go to, they're really big on the curvature of your spine. So they did something to work on it. They threw her on a vibration plate for like 5 minutes. She threw up.
Oh, I was going to say, ooh.
She threw up. Okay.
Yeah.
Not normal.
Surprised as an OT. So yeah.
Not normal, right? And it was like, oh, wow, something's wrong there, right? And I didn't have enough training yet to do anything, but I did kind of my best little mini evaluation, not knowing what it really meant. And she bombed it. She did horrible. And but and then shortly after that, I'm at this brain injury clinic, seeing all these patients from all over the world. And who are coming in knowing they've got concussions. And then one day she's like, oh, well, all this stuff's not normal. I was like, no, it's not normal. But she had adapted, and it was so common for her that it became normal to have brain fog, to have memory issues, to have some mood changes. I mean, she even had a sleep disorder from gluten, had all this stuff. And I was like, wow. So these are the people who come in knowing it's a concussion. And then we dove through her past. She had 3 concussions that were never diagnosed, never evaluated, never treated, blamed on her hormones, blamed on puberty.
Sure.
And it was like, wow. And since being in practice, I can tell you, I treat those who know they have concussions, but a lot of those who come in, they've got concussions in their past, but they come in with depression, brain fog, word finding issues, maybe more irritable, and you're just like, that's the majority of those still dealing with concussions. They're not actually looking for help with a concussion.
Right, right. So that's like really interesting. And like you said, it's something that like a lot of people don't know, but as functional providers or holistic providers, we're always kind of looking below the surface, right? And that's things that like most conventional doctors don't have time for, or they're not trained to understand. And so, you know, how did you guys start working through this? Because I'm sure it was like, unsettling to you as her husband to see this. And so how did you guys start working through it?
Yeah, so let's start with kind of the evolution. So first was when we first met, right? She was having these headaches all the time, and she was told by her conventional doctor back when she was in, what was it, high school, that
Yeah.
she needed to increase her salt and sodium intake and that she
Oh,
needed to eat chips and drink Mountain Dew. So she was drinking
oh,
Mountain Dew every day. Okay. I wasn't the smartest college student, but I
yeah,
knew that didn't seem right. So I was like, you know what? You
yeah,
just need to get off caffeine. Let's just stop. That's probably not good. She did
right.
that. The amount of headaches reduced.
Oh, yeah,
But,
yeah,
there were still some other things. And then as I was learning about functional medicine, it's like, look, I can't ask my patients to go gluten free if we're eating unhealthy, right? I can't ask them to do this if we're not willing
no,
to. So
yeah,
she gets off gluten, the amount of brain fog and forgetfulness instantly, reduced a ton.
yeah.
Like it was massive. She had a sleep
Hmm.
disorder completely went away when she off gluten. So it was like, whoa. And now anytime she gets exposed to gluten, you give it 30 seconds to a minute. Here comes a headache. Here comes a brain fog and some
Yeah,
stuff to
yeah,
her tongue. And you're like, okay, wow. So that's one side. And because she improved so much from that, you know, it wasn't until we later did some of her testing that we're like, oh, whoa, there's all this other stuff where she's like, I didn't realize it wasn't normal that if you're jogging and you need to turn, that you have to stop and turn. She's like, I thought everyone just did that,
everybody did that. Yeah, right, right.
you know? And so ultimately bring her through, we evaluate her brain health, eye movements, balance, other things like that. And then we reconnect the brain just like you would a muscle. And as we do that, it's like, okay, wow, I'm no longer dizzy when I'm sitting in the car. I can do this. Or when I run, I don't have to stop to turn. I've got
Right.
better energy, mood gets better regulated, and everything else like that.
So let's dig into the diagnostic side of this for people to understand, our listeners, because obviously you and I like treat people and help people every day and are so intimately connected into how we treat traumatic brain injury and concussion. But let's kind of unpack, like, for people, if they are struggling with something like this and have these issues, how do they get proper evaluation from a holistic person?
Yeah, let's first go after some of the myths, right? So,
Yeah.
a lot of people who think they've suffered a concussion go to the ER, they go to the urgent care. They're going to
Yes.
miss at least half of the concussions easily.
Yes.
And
Yeah.
also know when the ER tells you your CT scan is normal, that doesn't mean you don't have a concussion because CT scans do not pick up concussions at all, ever.
Well, I'm glad you said that because this just happened this past week. I have a friend whose daughter had a concussion at school. Took her in. They did an evaluation. We're going to refer out to concussion clinic because they weren't open yet. But they said yes, CT was fine. And then also the other thing was, oh, there's not blood behind the ears. And then that was kind of their report and findings on that. And so I'm so glad you said that because that comes up all the time, that it looks normal, but people are still struggling, right? And so as intuitive practitioners, we're trained, let's ask some more information, ask some more questions here, because clearly if the patient or the client isn't feeling well, then the reporting doesn't matter, the testing.
Yep. Yeah. I mean, it really just means you don't have a bleed, you don't have a fracture, which is
Yeah.
fantastic because you don't want that. But
No.
the thing is, when they tell people that, it kind of belittles and diminishes what a concussion is. So people think like, oh, well, they told me I'm fine. So then they start second doubting, well, is a concussion really that bad? Should I really be
Right.
feeling this way? Or is there something else? And so they don't take it as seriously. And because of
Yeah.
that, a lot of people, even if they get diagnosed in the ER, it's at least half of them will never have one follow-up visit by any provider, not even someone who's qualified or not. So,
Sure.
so now that we've got that out of the way, what does an evaluation actually look like?
Yeah.
Well, we're in a time where you should be getting objective testing for concussion. We have computerized testing that you can do for both balance and eye movements. Those are the two most important things when we look at concussion. But get
Yeah.
computerized testing. Okay. I understand lots of physical therapists do stuff like this where they track. I don't like it. It's not reproducible. Every
Yeah.
single person's going to document what they saw differently.
Sure.
We have the technology to record your eyes and to hit play and to show you here's what your eyes actually did. And then as you improve, we can go back and show you a comparative. Here's your before, here's your after, because guess what? Everyone's at risk of a concussion
Yeah.
and you never know when it's going to happen. And the best thing that you can do, especially if your kid's playing sports, even though sports are not a top 2 cause of concussion. So, let's kind of get that out of our head as well. Um,
Yeah.
that becomes your new baseline.
Yes. Yes. The baseline is really important. Yeah. Exactly. Yeah. So like what is the actual let's talk about what is the actual name of the eye testing that you're suggesting? Like if they were to go to, if they were to go find somebody like yourself, that really, specializes in brain challenges and such, what is the actual name of that testing for them?
Yeah. So, depending on the provider, they're going to call it video oculography or video
Yeah.
nystagmography. Basically, you should be wearing goggles. You're going to be doing a variety of tests. You're going to be looking at stationary points at different parts of the screen. You're going to be
Yeah.
tracking targets left and right, up and down. You're going to be watching something with stripes or maybe it's dots rapidly moving across the screen. And then you'll perform something where you're shifting your attention. That
Yeah.
those allow us to measure different parts of the brain, and that's really what you want. Because I've had people like, oh well, I've worn the goggles before, and then they do the testing, they're like, oh yeah, I didn't do any of that. They did more of a vestibular nerve damage test where they just get like air or
Yeah.
water squirted in their ear, and that's all they did.
Yeah, yeah, exactly. Okay, so like, and how long, like, is this testing expensive? Is it normally covered by insurance? Like, do people have to pay out of pocket? Like, how do you guys do that in your clinic?
Yeah, so we run a blend. We do a little bit with insurance, but we're also, a lot of people are self-pay because it's why you're doing it. So if you've got a concussion with the right
Mhm.
symptoms,
Yeah,
your insurance will cover it depending on the provider, right? A lot of people that do this are chiropractors only. Guess what? They're not going to cover it if a chiropractor does it. It doesn't matter.
sure. Yeah,
And so, that's kind of the big thing with insurance. It's people like, oh, well, they still don't cover it. It's like, no, but is it for the right provider? Is it for the right reason? Because I have lots of people who I do this test on where I know their insurance won't cover it, but they've got brain fog, they've got fatigue, they've got word finding issues.
right.
Where I'm like, I still need to evaluate the health of your brain. And because I'm not looking to try to make a ton of money off this test, it's more of a good diagnostics. I charge
Yeah.
$60 self pay to
Okay.
do
Okay. That's
a
good to know.
30-minute battery. And then that includes another 15 minutes of balance testing.
Okay, okay, that's good. That's a good like ballpark for people to understand. And I think like in the functional space, the challenge for all of us providers is that a lot of the things that we do, insurance isn't going to cover anyway. And I actually was talking to a friend who's a chiropractor, and he runs a clinic similar to yours. It's more traditional. He does sports medicine and such, and he's like, we have like two office people just to handle the insurance, claims and all of that. And so it's incredibly expensive as a business to actually take insurance. And I think as a society, kind of reframing it, like you said, that like our health is our investment. And if you've got brain fog or, depression and anxiety from like a concussion, if you're not able to get pregnant, like there's things that we are going to have to pay out of pocket for. And I actually have done that over the years with my own family and some of our health challenges, because it's just not, it's not going to get paid for. So I appreciate you giving insight there. So let's kind of start kind of peeling away the layers of the onion here. So like, once they have the testing done, and then there's definitely probably some sort of protocol or treatment plan, that you make recommendations around, for them to start to heal. And so what does that look like? Once they have the testing done, it's defined what's going on, and then the next steps.
Yeah, so each office is going to be a little bit different, but what we do is we do treatment in office first. A lot of people are like, oh, just give me the stuff to do at home. But when I show people their videos, I'm like, well, how did you think you did? They're like, I think I did good.
Yeah.
And then you show them the videos, they're like, whoa, my eyes were skipping and they were not still. And it's exactly, you don't realize what you don't know. So would your gym trainer let you do a lot of stuff at home if they didn't know you could do it properly with the right form? No,
Yeah.
because you don't want to reinforce bad form. Same thing
Yeah.
true with the brain. We want to make sure, one, it's done right, it's done safe, because the brain is very different than physical therapy. Like
Yes.
physical therapy, push through some of the muscle stuff, right? Push through it.
Yes.
That's okay. With the brain, some people it will be okay, but the more severe someone is, the more likely you are to flare them up and they're going to hate you and you'll actually make them worse.
Yeah.
And so,
Well, and two, like, and you've talked about this on other platforms, is that like having people understand that a concussion like has multi layers, and when there is a concussion, there is going to be inflammation, right, in the body, and there's going to be inflammation in the brain, and then that can impact that gut brain connection, which influences, it's bi-directional. For so many years we always thought it was the brain talking to the gut, but we know that, it's all interconnected and it all communicates with one another. So, like, if we look at it from that standpoint, from an inflammation standpoint, I mean, I would say that concussions like can be cumulative over time. So, like, your wife had 2 concussions, and I've treated many people over the years with multiple concussions. It kind of just can build on each other if it's not addressed right.
correct. It can build. And the thing is, it's not like you've got a regular blood test that tells you how much inflammation's in the brain. People are like, oh,
Yeah.
well, my labs look normal. But a lot of people, it is off. So you need to get your labs done, right? Because you can't treat the
Yes.
brain. It's like a plant, right? I view the brain as a plant. You wouldn't buy a plant, throw it in the soil. If the soil sucks, there's no water supply, there's too much or too little sun. You want to make
Yep.
sure it's set up for success. We do the same thing for the brain. Now, where it gets really interesting in the brain is we know with some traumatic brain injuries, inflammation in the brain can persist for at least 17 years.
Yes. Yes.
Okay.
Which is fascinating. I mean, to think about.
There was another study recently done by University of Virginia. And it's a small study, but when they do more, it'll be interesting. But they looked at athletes who they returned to play who passed their balance, eye movements, cognition, and symptoms. They found if the individuals had 2 or less concussions, when they did their brain imaging, they actually had no inflammation in their brain. But if they had 3 concussions or more, their brain was still inflamed despite being returned to play.
Right, right. And then, like, from a aging perspective, and you start digging into all these things that impact our health, it would make sense that, you've got so many other factors at play as well. Like, what is the individual's diet? Like, what is their stress management strategies? What is their sleep? Because we know the sleep is so intimately connected with repair mechanisms in the body, right? So it's hard to pinpoint because everybody's a unique individual. And so what has been one person's experience is different than another, which is why you really need an individualized assessment for that person, right?
Correct. You need to individualize. You don't shortcut stuff. My 5 pillars of health are how do you eat, sleep, stress, exercise, socialize. Everything else
Yep.
builds off it, but I can't tell you how many people come in. I'm like, oh, it looks like you've got concussions, but they can't sleep worth anything. They don't exercise. They're diabetic. They have no hormone production, right?
Yeah.
And it's like, look, those have to be addressed too. It's not just one thing. And that's what you really need to make sure you're looking for in providers is there's a lot of people that are good symptom whackers. Like, oh yeah, you're coming in, you've got your neck pain, your headaches. I can do that. It's like, well, do you know why they have it? No, I mean, I just do the same thing for everyone that's got it.
Yeah.
And yes, those people
Cookie
may
cutter
charge
approach
less.
does not work. Yeah,
You know,
cookie cutter approach does not work.
correct. They'll charge less. Their appointments will be shorter. Their initial evaluation, it will be, but it'll cost you
Yeah,
more in the long run. And it'll also make you want to give up hope because you're hoping someone can help you who doesn't even understand the process going on within your body. And
right.
and that's why it's so important in the brain injury world and concussion
Hmm.
to find someone that's truly doing it. Because even a lot of these concussion clinics being opened up by these big hospitals, their providers aren't trained in concussions with
Yeah,
understanding the neuroimmunology and that whole side. They're just like, hey, no, we manage it. We send you to PT for this part, right? We send you speech for this part, but they're not doing the chemical, the cellular
right.
issues that actually occur with a concussion. And if you want the best results, you need to make sure you're addressing that. But not only best results initially, concussions are known to increase your risk of dementia,
Yes.
suicide, depression, ADHD, Parkinson's, multiple sclerosis, ALS, and we can keep going. It's these things that can develop down the road. And so you don't want to just symptomatically recover. You want to recover to the highest level of a true recovery.
Absolutely. Absolutely. And so it's multi complex, right? Because, you know, as functional providers, and this is kind of my beef with functional medicine, right? Is that we can very easily become green pharma and be like, oh, just go take yourself some N-acetylcysteine or, go do more of a ketogenic diet. And the thing is like you said, if they're with a provider that's making these kind of loose recommendations that aren't actually customized to that individual, then it actually can cause more harm than good. And you're not resolving those issues. They're still going to hang around. So it's really important to have a thorough evaluation. Interestingly, I actually was looking at research myself because that's what I do. But there's actually emerging research that's shown that, and this is tying into fertility, that women who have sustained a mild traumatic brain injury, also termed concussion, right, do have a higher risk of menstrual irregularities and sexual dysfunction. And that goes hand in hand with our mental health, right? Like if we're not being heard and we don't feel well, I mean, I'm naturally just going to be depressed. I mean, so and there's biochemical aspects of that as well. But when, we're being gaslit and we're kind of being told it's all in our head, it's really problematic.
Correct. And that's where it's really hard, like that's why I have a soft spot for teenagers because, like my wife, it was blamed on puberty, hormones, going through, you know, oh, well, you're changing friends in school. But it's the same thing that also happens to young moms is, oh, well, you've got the little kids, they're waking you up at night, it's just like, yeah, it is, but it doesn't mean you can't have kids waking you up at night plus something else going on. Like, but it always gets blamed on something instead of truly taking the time to be like, well, is there a better explanation for this? And that's the way medicine was supposed to work anyways. It's supposed to be you only get a depression diagnosis or you only get a postpartum depression diagnosis after all other likely causes of that have been evaluated and ruled
Yeah,
out. We
absolutely.
don't do it anymore. Like it used to be
No.
check that you used to have to check thyroid levels to put someone on a depression med. Not
Yeah.
anymore. You haven't had to for about a decade.
Yeah, and it's interesting that you bring that up because, being trained by Dr. William Walsh, who's a PhD and researcher, has spent his entire career researching mental health disorders and how that impacts people. And, I recently even just learned from him that women that have postpartum depression, a lot of times it goes back to a copper overload imbalance that can be easily like fixed if labs are being looked at by a trained professional with a holistic eye, and so these women have been said, oh, you got depression, you're fine, just keep powering through it. And as a society, that's what we were told is suppress, suppress, suppress. And interestingly enough, kind of going into the whole thing with just this prescription around medications and pharmaceuticals, Dr. Walsh was sharing with a group of us practitioners that 42 out of 50 of the last school shootings that have happened in the United States have ties back to SSRIs, and how many of these teenagers or teens, it's mainly teens, really never did have, they weren't acting out, they weren't deviants of society, which has been painted, but it was a biochemical imbalance, and then adding a pharmaceutical on top of that just like was where the bucket just overflows, right? Because that's kind of sometimes the analogy we use in functional medicine, is like when your bucket just fills up and then it overflows, then that's when we really experience disease and dysfunction in the body. So I'm glad you brought that up, because it's something that's not really talked about that much, and many people don't know about it. So,
Yep, correct.
yeah. So, okay. So, concussion diagnosed. We kind of have this history on, multiple concussions. Definitely need to dig in even further, because, there's many factors that need to be considered. And then, once a holistic protocol, and I want to say holistic because it's all inclusive, right? It's the foundations of health, or your pillars of health, like you were saying, which is very much what I teach my clients. But once they have that, like, what is like an average timeline for remediation of a concussion or even a traumatic brain injury? What does that look like for most people that you work with?
Yeah, so for most people, they're doing 10 treatments over, a 2 to 4 week time frame. If they fly in, sometimes we even compress that into 1 week, depending on what they've got. Um,
Okay.
but most people during those 10 treatments, they're going to feel significantly better. So it's
Yeah.
actually going to be a pretty fast turnaround for the majority. And then they have a home plan that they keep building. Because what you first want is to go from feeling like crap all day, every day, to be like, hey, look, I've got a few hours, I actually feel pretty good. It's like, cool, right? Now you've kind of got to build up this cognitive endurance where
Yeah.
you can just have the stamina, because everyone knows as your fatigue goes, your symptoms go up. That's the
Grow
way
up,
you know it's
right?
your brain. That's one of the best ways
Yeah.
to know it's your brain, is as the day goes on, energy goes down, symptoms go up. Hey, you got to make sure your brain's doing okay, even if you're like, but I've never had a concussion. Well, there's a lot of things that impact your brain. It
Yeah.
doesn't have to
Yeah.
be just a concussion. But yeah, most people are doing really well by the end of about a month. Now, sometimes there's some additional build. And then there's a few cases where, you know, the concussion unearthed something else,
Ah, yeah.
which is a
Yeah.
whole nother ballpark.
Sure. Sure. And then that takes more time and just clinical reasoning skills to kind of figure out and connect the dots, right?
Correct. Yep.
Yeah. Okay. So that's really helpful. I think for people to understand, like, there are alternative treatments out there, and I hate even like calling it alternative, because it's should be mainstream. It should be like what we do in remediating some of these issues and dysfunction. But I know you and I are both working on that. Speaking from our platforms loud and clear on holistic approach to care. So let's kind of dive in a little bit more into clearly a lot of people that have concussions do have anxiety and depression, and some people just struggle with anxiety and depression and have never had a concussion. So how do you approach this in your own clinic and with your other colleagues? How do you guys do that?
Yeah. So with, depression, anxiety, I'm always going to look in the health of the brain, but I'm also going to look at labs as well
Yeah.
and say what, thyroid issues, insulin issues, inflammatory issues, vitamin D, other things like that. But that's part of it. But let's, like I said, let's go back to the basics. And one of the big things in business, anyone that listens to business podcasts and wealth podcasts are like, look, your income's going to be that of the 5 people who you spend the most time with. And that's what they
Yes.
always
Yes.
say.
Yeah.
Well, I have a sheet like that, which is for mental health. It's your mental health is going to be that of the 5 people who get your most time and energy. And I actually
Sure.
make people write it down, and they have to grade the people who get it. And if they can't give them check marks, guess what? They don't get better. It doesn't matter
Yeah.
what you give them, they won't give better. And some people, it's hard because it's like, but I'm 30. My mom lives 5 miles away. We go to dinner, but every time I go, they try to treat me like I'm the 10-year-old.
Yeah.
But I'm not. It's like, yeah. So you're trying to get a new identity and they won't let you, which means you have to establish new boundaries so they respect who you are, not who you used to be. And it's hard for people, but that's honestly is one of the most important things for people is being surrounded by those who are helping them get to where they want to be.
Yeah, absolutely. I so agree with that. It's like you know, being heard, simply being heard. And people don't feel heard, and that's where I think we can start to see dysfunction in their lives. And like, it goes back to what's so simple is your vibe attracts your tribe, right? And we are energetic beings, and so what we're filling our minds with, what we're putting into our bodies, has a massive impact on our overall health. So when people are struggling with anxiety and depression, it's really hard for them to take action, right? Because they don't feel well. And so where do you start in your practice in kind of turning that around for them, to get them back on track?
Yeah, it really depends on the individual, but I try to get people to do stuff that brings them joy because most
Yes.
people, when they look at their 24 hours, it's like, what was the last time you've done something that you truly enjoy that you want to rave about? And go and do it. And also
Yeah.
write down a positive from each day. Because as you spiral, right, with your depression and anxiety, you can walk into a room that has 1,000 positive things and 100 negative things, and you're not even going to see the 1,000. You're going to see the 100.
Yeah.
And so I'm like, write it down every day and then go and read it every single day because you need to start seeing that, hey, this is what it is. And then I also like the book Atomic Habits, like make what
Yes.
you want easy, make what you don't want hard, right? So like, guess what? Put stuff on your mirror, like put pictures up, whoever it is. If you're like, wow, I want to get back in shape, fine, right? Like I grew up watching Rocky movies. You put a picture of
Yeah.
Rocky up there, you're not going to be lazy eating Cheetos. Like you will not, right?
Right. Right.
So create an environment that's going to make it easier to do what you want because as much as we give good advice to people in the office, that doesn't matter if they won't be consistent with the behaviors. And I try to get them to really focus more on the behavior and not the outcome because sometimes
Yeah.
the outcome takes longer than we want. And
It
people will
does.
be like, oh, but I wanted to feel better after 2 weeks. And so then they become disappointed and when in reality, it's like, no, you need to celebrate the fact that you've been consistent. And with mental health, a win for you is a win for you. It's your definition of a win. It's not someone else's definition of a win for you. Because that's
Yeah.
something I see a lot is people are like, well, I mean, I did this, but it doesn't seem like a lot. It's like, yeah, but you're trying to use someone else's definition and expectation for you
Yeah.
to determine if you're succeeding. That's actually going to hurt you, right?
Yeah.
Use your own so you keep the right perspective.
Yeah, I like that a lot. And I do find like, gratitude journaling and like, a meditative spiritual practice is so key for like improved health outcomes and vibrant health and those things. And it can be so simple. It's like the foundations. Like I mean, I just tell people sometimes just go stand out in the grass. Just go stand out in the grass, get some sunshine on your arms and your face, because we don't realize the power of nature and how it can transform, those negative feelings or those things that we internalize. And I even know in my own life, like if I'm feeling down, just go serve somebody, like go do something that's going to help someone else. And then it kind of takes the negative or the focus on ourselves, off. And yeah, I think Joe Dispenza, like he talks about it even in like that mental, spiritual realm on, 95% of the programs that are running through our head are like, it's our subconscious, right? Repeating those programs that we learned when we were really early on or that we were conditioned to think. And so like only 5% of our brain is actually conscious, like in that space, in that moment, at that time. So I love those, very helpful habits and hacks that people can really implement, and it really doesn't have to be difficult. So what are options out there for people that are struggling with depression and anxiety, and they don't want medications, right? They're like, I want to do this more in a holistic way. And so, like, what other options would you suggest?
Yeah, I mean, as we talked about, the basics, and I get it. People are like, they're going to roll their eyes and be like, oh, here
Yeah.
it comes. He doesn't tell me exercise. And you're right,
Yes.
right? Exercise beats everything every single time in the research because it works. Find an exercise buddy who has the life you want, not the life you
Yeah.
have, but has the life you want, and go with them. Make sure you're eating healthy, prioritize your sleep, go and do stuff for yourself. Moms, I get it. I've got 5 girls. Okay.
Wow.
Like, I
Wow.
get it. Um, do stuff for yourself because everyone, one of the reasons I think women have so many chronic health issues
Yeah.
is they're trying to give 100% a 50, right? They're
Mm,
like, no, I'm giving my all. It's like, you don't even have your all. Your all is half of what it should be because you're so depleted. So
yeah.
self-care doesn't make you do less for your family and others. Self-care helps you actually give more because as you elevate from being only half of what you could be to 75 to 80 to 90, guess what? 100% of that will always be a higher level.
Yeah.
And it's important to keep that same framework. So that's one thing. Yes, if you need stronger things, right? Like kind of a more mild level, supplements. But you also, if you're breastfeeding or pregnant, some of the supplements you really can't do.
Yeah. Yeah, there's not very many actually, that, are actually safe and that have been tested. Which there needs to be a lot more research on that, I think. So it's a
Yep.
good point.
Yep.
Yeah.
There needs to, and then if you do have concussions, obviously you get the concussion stuff. You also have transcranial magnetic stimulation therapy that can be done safely in pregnancy, breastfeeding,
Yeah.
anything like that. And basically, that's a magnet, gets applied, delivers pulses to your brain to change the way the brain's firing to help with depression. Works pretty good. Um, you know, no medications with that.
And would that usually be like they could find that service like in a neurology chiropractic practice like your own, or like where could they find a service like that?
Yeah, so most of the time, I mean, yes, I do have it, but most of the time it's going to be in a psychiatry practice. Psychiatry
Okay.
practice, they've got it. Um, it is billable at psychiatry practices for most insurance, but you must have tried and failed 4 to 6 medications depending on the insurance company you have. So
Right.
for those that don't want that, it's best to just find someone who does it. They're using the latest protocols and just
Yeah.
find, who's got I'm not going to say shop the cheapest, but shop someone who understands it and they make sure you're set up for success. What I don't want you to do is take anything we're talking about today and be like, oh, that's my magic bullet. Because
Sure.
I've got plenty of people who I'm like, oh, maybe they could do, maybe this is what they need. I get through the testing, I'm like, not what you need.
Yeah. Yeah. I actually had a client I've been working with for a couple of months with some pretty complex health issues. She's in her late 30s. And I initially did some testing, and we were going to do some other testing, and she was asking me when we were going to do it. And I'm like, well, you know what? I'm kind of pivoting on where I think we should go here. And I think that's like a key thing for many people to understand is when you're working with somebody that's looking at health more from a holistic lens, like they're doing detective work, and it takes time to get to the root cause of many issues. It might not be so obvious, like a past concussion or something like that. But a key thing for them to look for in a practitioner is somebody that's going to meet them where they're at, that's going to be walking with them, that's going to be in the trenches, that's listening and hearing what they're saying. So I like that you made that point.
Yep. And like you said about, changing and directions and pivoting, it's don't be frustrated with your provider if they pivot. You know, that's yes, some of them, right? They may not be sure, but others, that's actually a good provider because something
Yeah.
else came out versus them continuing with something that they're just doing because that's just their protocol.
Yes.
That doesn't make someone a bad provider. And then be willing to step outside of your comfort zone. Because I can't tell you how many people come in, they're like, all right, Dr. Z, I want you to treat me. And then they tell me what they want because they read it on Google. It's look, when we make recommendations, we appreciate what you're saying. We are listening to you. But I'm also using over a decade of experience to say, in other situations like this, what has the likelihood of success? When
Yes.
you're
Yes.
on Facebook groups, Google stuff, Reddit, whatever, none of that applies. It's literally someone who's trying to make everyone believe something they did because it worked for them was a magic bullet. And what
Yes.
no one ever questions is, why did it work for you?
Yeah.
Not what did you do?
Absolutely.
Why did it work for you? And find a provider who can help you understand that, and then be willing, once again, to step out of your comfort zone, because we may ask you to do stuff that's outside of your comfort zone. But what do we know about comfort zones? That's where dreams go to die.
Yes. I love that. Yes. You're so right. So good. So this has been an amazing, enlightening conversation with you today. I've been looking forward to this interview. And so I'm going to have you back on because I know we can talk about like many other things and helping women and couples struggling with infertility and hormone issues. And I do think I want to state that a lot of times hormone issues, and I think you hit this earlier, is that can be caused by past trauma and injuries such as concussion, traumatic brain injury. There can be many other things, but that's a key thing that we would look for when we do a health history with somebody, right? So where can the audience find you? I know you're in Idaho, but it sounds like people can come in from all over, especially if they have a past concussion that needs treatment or brain injury.
Correct. Yeah. I mean, my website, drspencerzimmerman.com, and then it's really that on any social media. I do put out a lot of education because
Yeah.
there's just a massive lack of awareness on the impact of that, but also just in the brain in general.
Yeah,
Try-
absolutely. And you have a book because your book's out there. I actually have it. It's good. You want to tell them what the name of your book is?
Correct. So it's Brain Reset, 7 Steps to a Healthier Brain. You can get that on Amazon. And the reason I really wrote it is because, I don't really like teaching people about nutrition stuff.
Yeah.
I don't think you should have to pay me for me to tell you the basics. I would like you to do that. So that way, when someone does fly in for care, they're set up for success. It makes my life easier. It makes it so they get better results from the beginning.
I 100% agree with you. I mean, I've actually just recently published a chapter in a book with a group of other practitioners, and it really does make our lives easier, and we can spend more time like around more of the complex issues at play when people have like started to hone in on those foundations of health or those pillars of health, right?
Yeah.
So, well, it was great to have you on, Dr. Spencer. We will look forward to this being released. And for everyone here, we will have his website and book and all of that in the show notes. So look for that under the podcast. You made it to the end of the episode. Let's keep this Gutsy fertility party going with some next steps to empower you along your wellness journey.